what concerns you about the healthcare industry? Anybody? Yes, sir.
I think the silence indicates partially that we don't even know where to begin.
The United States is a nation obsessed with the idea of health, yet as a whole is frustrated by the topic of health care. We are a nation boasting the highest standard of living, yet we are significantly less healthy than other developed countries. Fear of being able to afford health care has been on the rise since the 1980s, while America's overall life expectancy has increased since the 1990s. Illness and chronic disability account for nearly half of U.S. health burdens, so people are living longer, but not necessarily in good health. We have equated quantity of years with quality of years, and there doesn't seem to be anything healthy about that idea. To localize, humanize, and explore this topic, we interviewed recipients of long-term health care within the Austin, Texas area. We then interviewed specialists throughout the state of Texas. After that, we traveled to Baltimore, Maryland to interview a leader in the healthcare debate from Johns Hopkins. Because this is not just an issue of one state and a nation. This problem is endemic of the United States.
I think a lot of our medical treatments are just cruel. Rather than discussing options to decrease suffering, the suffering's increased to prolong life, to allow for more profit. The majority of the people that I took care of on a daily basis had diseases or illnesses that could have been prevented. But you're not going to get that kind of information from a facility that is profit-driven off of you being sick. If you're not sick, they're not making money. The more sick you are, the more money they make. That's the way that it is.
What we have in America is a healthcare industry where perverse incentives have resulted in a system where patients routinely fall through the cracks. We've asked doctors, are doctors more likely to perform unnecessary procedures when they directly profit from them? 73% of doctors say yes. Only 50% of the general public said yes in answer to the same question. It's almost as if doctors know something about the culture of medicine that the public is not fully aware of.
There are a lot of stakeholders who are very powerful, who are making an awful lot of money off the way the system works now. Or I guess I should say the way the system doesn't work now. When you have a lot of people who are benefiting very heavily financially, they're not motivated to change it where they actually decrease their bottom line.
The insurance companies don't care anymore. They don't care that cost just keeps going up because all they're doing is just charging higher premiums, and guess who pays for that? In 20 years, there's no one's going to be able to afford it, and they don't care because they're all making money, hand over fist.
We handpicked a group of strangers who had different political ideologies to talk about the issue of healthcare as a social experiment. The only rules of engagement were to be respectful of whoever was speaking and to express their views without any mention of political affiliation, politics, or politicians throughout the entire discussion.
I consider myself a really good, healthy specimen, quote unquote, and I still feel like I pay a lot. I guess what I hear from people is it's malpractice lawsuits. That's the reason why you end up having to pay as much as you do because so many people sue. And after a while, it just starts to not really seem like it makes very much sense because it's like, if we're all paying this much money, and they're only paying out this much money, it doesn't seem like that equation really balances out. You want to talk about math, somebody's making a lot of money, because it seems like we're spending a lot of money.
doctors themselves have to get malpractice insurance.
Yeah.
So they're passing that cost down to the consumer. They're also charging the doctors for it. I mean, everybody pays for all of that. Doctors pay like $250,000 a year sometimes in malpractice insurance. So why am I paying for it too?
I talk to patients that are pissed off. They are getting crushed right now by a system that ping-pongs them around, that doesn't have full disclosure sometime about treatment options, medical mistakes, and hospital performance, and people are getting crushed with their bills.
Because we've had hospital officials even admit that they know that it's unsustainable the way healthcare costs are just going. Yeah. That something's got to change. But they're so, even the not-for-profits are so profit-oriented.
Who were the ones with insurance? Kevin, Shelley, James. Okay, so how much do you pay a month in insurance?
I pay $440, and it's for myself and my son.
My employer covers 90% of it, so I pay $56 a month.
$56 a month for yourself?
For myself only.
I pay $109 a month, and it's just catastrophic insurance, so I have a $5,000 deductible, and then they don't cover like one part of my body.
One part.
Basically my neck. Anything in my neck, they don't cover.
When I have enough union hours banked, I don't pay anything a month, but when those run out, I go on Cobra, and that's about $450.
Just for yourself?
Yes.
If you compound what patients are paying for insurance, and employers and employees and dependents.
The Millman Index is the healthcare policy term for what the average American household pays for their healthcare every year, all things combined. Co-pays, deductibles, health insurance costs. Right now in America, it is $9,200 per year for an average American household. It's the only business where you can't get a bid on a service, you don't know how much you're paying for it while you're having the treatment, and a lot of times you don't even know how much you paid for it afterwards.
If you were to survey physicians and ask them what an MRI costs or what an ultrasound costs or what this blood test costs, 8 out of 10 would not know the answers. Patients are insulated from the costs or shielded. Doctors are insulated from the costs. How are you going to make a cost-effective system when all the key players in the doctor-patient relationship, the doctor and the patient, don't know what anything costs?
There doesn't seem to be any balance to it or any check on that. So it becomes so complicated that tracking down exactly, well, how can we make the system more efficient? It seems like nobody has an interest in making it more efficient, except for patients and doctors too on some level, but having a clean, clear, efficient system is something that it's very hard to even start to know where to begin.
The system right now is frustrating doctors as much, if not more, than it's frustrating patients. After all, many of us went into the profession to do good to patients, to contribute to society in some meaningful way, and we walk into a system contaminated with the business of medicine, which has a political system which talks about different ways to finance the broken system. We need to stop talking about ways to finance the broken system and start talking about ways to fix the broken healthcare system.
And the Institute of Medicine just released a report that says there's over $760 billion a year of waste. Unnecessary tests, unnecessary procedures, fluff in the system. The systems don't talk to each other. The whole system is broken. It doesn't need reform. It needs a revolution. It's not something that you can just tweak a little bit and fix it. I really think it's like, are you going to remodel the house or are you going to demolish the house? And I think there's a lot of people who believe that there needs to be a revolution in healthcare.
A lot of time with the insurance, they'll pay for certain people for certain amounts, and then the insurance will pay 60% of this type, or 50% of that type, or 80% of that type, and you never know.
But if you've got a procedure, like something that you've booked,
if it's something that you booked ahead of time, then yeah, you have time to work to figure it out. Yeah. When you're there, and some random person walks in, and then 3 months later you get a bill for somebody you don't even remember even being there, or what they did, or why they were there.
You have no idea how much that is going to cost, and then when you get out of it, your insurance is going to say that we're going to pay for this person and this one, but not for these two. But why are those two in that hospital?
Some other insurance company covers them.
Because his insurance will cover those two, but they weren't covered.
And how do they choose who they cover and who they don't? Don't they all have like some kind of...
We don't agree to the billing
Yeah.
system. If you agree to the billing system that the insurance company will pay, then you can then they'll sign you on as a doctor. But when you're in the hospital and they walk in the door, you don't have any control. You can't say, "Are you under my insurance?" Or then you need to leave.
Yeah.
You know, there's not an option for that.
But like whenever you buy anything, like let's say you go to a bar and you buy a beer, you can ask how much this is going to cost, and they tell you it's $3.50 or $4.50, and you go, "No, I'm not interested in paying $4.50. I'm going to another bar."
Yeah, it's like if you go to a bar though, then it's like, okay, $4.50, they can tell you maybe $4.50. It's like, okay, hang on, I've got 9 different people paying a little bit of this bill. I have to ask all of them.
When you sign up for insurance, they give you this booklet and they're like, okay, for an MRI we'll pay this much, for this procedure we'll pay this much, and if it's this procedure plus this procedure or this part of this procedure or this, it's impossible.
I know that my girlfriend is still paying for her anesthesiologist from a surgery that the insurance covered, and the doctors were paid, but this, random other doctor, anesthesiologist, was not, and somehow got out of the loop. It's just like the credit card companies, the letters are changing colors and final notices, and it's like, what are you going to do to me? Exactly. Are you going to put me in debtor's prison? Because I can't pay this.
There's seems like there's very little control over it, or there's so many changes that it's just really hard to keep up with, even for them. How are we supposed to keep up with it?
It's not just insurance for me, it's insurance for my son as well. So when he was born, he had like a slight heart murmur. He decided he wanted to play football, and my mom brought it up during the physical, so then the school made him go and get a cardiogram. And the cardiogram came back and they were like, yeah, he's got the slight murmur, but it's fine, it's not a big deal. But it was weird because they called me back and they were like, so what's up with this? How come you didn't tell us about this cardiogram that he had? You guys have the results there, right? You see that it's fine. And they're like, yeah, we're just wondering how come you didn't mention that. And I was like, I just didn't think to mention it because it came back negative. It made me feel like I don't know, they were suspecting me of trying to pull something over on them, and all I was trying to do is just sign up for insurance. I'm not trying to rip you off, dude. I'm just, trying to get insurance for me and my kid. It made me feel like you really have to be careful what tests you get done and what you get checked out, because later on it could come back and haunt you. Why did you get that tested? Why is it a bad thing for me to want to take care of myself on my own, and find out whether or not maybe something's wrong ahead of time, so I don't have to wait till after the fact.
One time I had a disc bulge in L4, L5, and then another in L5S1, just, small herniation, 2006, and then, it got better, and then I had to get insurance, and they said, okay, fine, because of this thing you had a few years ago, we're not going to cover your spine or anything. It gets better. Or anything radiating from your spine, which I don't know if there's anything left. And it's absurd because it was a disc bulge. It went away, and now the question is, if I get hit by a car, are they not going to cover anything spine related?
I had a pre-existing condition. Yeah, I felt like I was some kind of racehorse that was being bet upon. They were like, we will take that bet of your health not going south. The one and only thing you need help with, yeah, we're not covering that. Yeah, so that's very frustrating.
I'm a single parent of 3 and I'm self-employed. So I'm the sole provider of my family, but my kids are on Medicaid and I make just a little bit too much to be on assistance as well, so I'm without insurance. I needed a hysterectomy, and Medicaid said, well, we're not going to cover you because it's sort of like a pre-existing condition. So I started calling the hospitals trying to get finance to get the surgery done. They just kept saying, well, you need at least $10,000, $15,000 put up front. Well, I don't have that kind of money. And we found a way to get myself into the emergency room and just say it's, I was in bad condition, but just go in through the emergency, and they took me in right away and had the surgery done that way. It's it was frustrating because you had to jump through hoops through Medicaid with their system, and then, trying to get approved and get this going so I can stay healthy for my family, and threw me out to the wolves. Oh well, who cares? You know.
So what was your pre-existing condition? The fact that you had ovaries?
That's what I was. I guess so. That's what I asked them. But they just kept saying, "Well, no, we just don't cover that." It's like, well, it's becoming a serious health issue for me, and I'm not well. And they said, well, you're just going to have to find other means. I'm trying to pay for it. I don't have the large amounts of money to pay for it up front, but you know, it's going to be on my credit, and it can stay there, I guess. It was right around probably $30,000.
So it would have cost $10,000 to $15,000 if they would have covered it, but it cost $30,000 because you had to go through
the emergency. I do worry about that, you know, because my kids don't have anybody else to rely on but myself. And if I get ill or get cancer or something that I can't come out of, that I'm not going to be able to pay to get healthy again through the hospitals, because they probably won't accept me.
It's kind of very random or capricious that you're covered, you're not.
When I think about people who really don't have insurance and need care that puts them in debt that they will never get out of and that totally ruins their credit, but what other choice do you have at that point?
My name is Michael Ginsberg. I work at an adolescent treatment center with adolescents and families suffering from problems with addiction.
What was your lifestyle before all this happened?
I ate well, I worked out constantly, I biked, I walked a lot, even ran sometimes. I spent a lot of money on organic foods and vitamins and supplements and all that stuff. As healthy as I've ever been. The only sign I had that something was off was a bump in my neck. Being 24 years old, I didn't think it was anything serious. I wasn't that concerned, but people around me started to get concerned. Family, friends were kind of like, what's that on your neck? And I tell them what I thought, and they say that doesn't seem right. And after months of that, of kind of remaining in denial and defending my reasons for not going to the doctor, which included not having health insurance, I kind of broke down and said, you know, all right, I'll check this out, it's not going away. It was in the morning, and she called me and asked me if I wanted to meet her for lunch. And I said, okay. When I pulled up to her office, her and my father were standing outside, and they came up to me and said, we got a call from the doctor, you have cancer. And I was kind of speechless. I didn't break down and start crying or anything. I just kind of was like, oh, well that sucks. Because I didn't feel sick. I knew it was there, I knew it was in my body, but I didn't seem to be having any symptoms. Maybe I was, you know, a little more fatigued than usual, but very minor stuff that could have been easily confused with too much work or too much caffeine. So between the time that I was diagnosed and the time that I started receiving treatment was about a month and a half stretch. In theory, the second I got the diagnosis, I should have began treatment. It didn't work that way. I didn't have health insurance. I had a couple of hospitals or individuals at hospitals, financial people at hospitals, say things like, come back when you're stage 4. Just things within that realm. Like I wasn't sick enough to be treated by hospitals. I tried to get a MAP card, a medical assistance program card, and I made too much money. I made upper 20,000s with no benefits of any kind to speak of, and I made too much money. The woman that I actually spoke to there told me that if I can't find somewhere to get treatment, what I should do is either quit my job or purposely get fired from my job. And that way I could claim to be indigent and would likely have a better chance of getting treatment than if I was working. So what I felt like at least was that I was being penalized for actually having a job. I called a hospital in Houston who was very helpful at first, She asked me to send all my financial information. W-2s from the last like 5 years, recent paychecks, electric bills, anything with a number on it. She got back to me very quickly and said that she was happy to inform me that I'm going to be covered 100%, that my treatment will be covered. And I mean, I was just so relieved, so happy, so thankful and grateful. I mean, right on the spot, I scheduled my first appointment. It was the next day, it was Friday, I got a call from the same woman saying that she messed up. She's sorry to report that she messed up on my paperwork. And she said what she did was she looked at the wrong W-2. I was screaming at her like, have you lost your mind? You're gonna say you cover me and then you're gonna sign my death warrant, 24 hours later? Like, what the hell is wrong with you? And she calls me back and says that they can cover 50% of my treatment. I didn't know what treatment cost, but I figured it was a lot. And I simply said, you're crazy. Because you know how much I make in a year. There's no way I'm going to be able to give you 50% of what this treatment costs. I just knew from stories that I've heard in the past that there was just no way. And she said, well, if you'd like, then I could just cancel your appointment and that would be it. And I was like, no, keep my appointment. I'll take the 50%. I'll figure out a way. I'll take that. Keep my appointment. I'll see you on Monday. Marched into the financial office in Houston. Gonna work out whatever deal we could. If I had to pay this off for the rest of my life, so be it. I met with this woman that was very calm, very collected, and started to explain things to me. What they wanted to do at this point, by the time I'd shown up in their office, was I would owe them 50% of the 50% up front. So I still had to pay 50%, but I didn't have to pay all 50% up front. I basically paid 25% up front. Okay, but what's 25% and what does up front mean? She says, well, you'll get treatment every 2 weeks. What that means is you have to hand over a check every 2 weeks before your next treatment. Okay, I understand that. What would that check be? So she pulled out the paperwork. She's like, well, that check will be approximately $37.5 thousand every 2 weeks, which was more than I made in a year. I was just kind of blown away. I was like, wait, and at first I thought she was showing me the full amount, like that was the 100%. Each chemotherapy treatment that I went in for was actually about $75,000. 50% of that, which is what I would owe in the end of it all, was $37.5 thousand. What I would owe every 2 weeks, what I had to turn in, was $17.5 thousand every 2 weeks, hand over a check. And I was like, why are we even talking? Like, if I had that kind of money to throw at you, first of all, I'd have health insurance, I think. Tell me what I'm paying for. Show me. Like, what can we cut out? Like, let's get real about this. Like, what don't I really need? And so she did. She pulled out a piece of paper, descending order from highest price to lowest price. Highest price was the actual chemotherapy medication. The next one down was $6,000 for something called Neulasta. What is this called? What is this? What does this do? She's like, well, Neulasta is a shot. Okay, what does it do? She's like, well, it's like an immune booster shot. She's obviously giving it to me in layman's terms. What I do is 24 hours after the chemo, I give myself the shot, and that boosts my immune system. Wait, it's $6,000 and I gotta give it to myself? Like, you don't even give it to me for $6,000? I mean, you'd think I'd, at least get that. She's like, no, it doesn't work that way because you gotta give it to yourself 24 hours later. It's like, okay, fine. What happens if I don't take it? She's like, well, in theory, if you don't take it, your immune system can drop dramatically. You could get sick from a cold and it could kill you. Okay, so I need that one, is what you're telling me. She's like, yeah, you need that one. Everything on that list was, you couldn't argue out of it. Like, a medication to stop me from puking my guts out for the next 6 months. Obviously that was necessary. So, I mean, it was just each one, there's nothing on there that was extra or to make things easier. It was all like the bare necessities, and it was still astronomically expensive. I felt like I was losing it. I did. I walked out, left my mom and dad in there. My dad comes out, and my dad says that she wanted to speak to me again. And I was like, why? Like, why? Is she just trying to make me more angry? She's trying to like make me go postal in the hospital to see what I would do? He's like, I don't know. He's like, she just wanted to speak to you again. I was like, all right, fine. And she's like, good news? She's like, we're gonna cover you 100%. It's like, wait, I'm confused. She's like, front to back, we're gonna cover, all of your treatment. Whatever you do here in Houston at our hospital is covered. I was in shock again, and I didn't know what to say. Where do I sign? Like, let's get this ball rolling. And she gave me the paperwork, and I signed it. And before I left, I couldn't help it. Like, I had to ask, how did we go from me owing you like $1 million to me owing you nothing in about 5 minutes? And she said, I want to talk to my supervisor. It's like, and? She said, well, I went to talk to my supervisor and said, basically told her about your plight up to this point, kind of some of the mistakes we made, all the difficulties you've had getting treatment, getting through the door, all the doors closed in your face. And she said, well, let's cover them. And she signed off on it. You have to understand, there's a lot of money that runs through this hospital, so your $1 million really doesn't mean a whole lot to us, to be completely honest. I was like, oh, okay. Thank you for answering that question. So we stayed in a hotel not too far away and used money that none of us had at that point. We really had spent all the money we had towards just getting all the testing done up to that point, which was incredibly expensive. I mean, we're talking about blood tests that cost like $800 for them to take a vial of blood. So we really didn't have money, but we didn't have a choice. I mean, we weren't going to drive back and forth from Austin to Houston twice every day for a week. So as soon as I finished radiation, I started showing up for 40 hours a week of work. My hair has just slightly started to come back. June 1st of 2010, I got a call from the doctor after testing about a week earlier. They have found no trace of cancer in my system at all whatsoever. As of now, I'm in the clear. So that's a big day for me, and I celebrate on that day each year. Mid 2010, I started not to feel good again in a different way. My stomach started not to feel good. I did what probably other 25, 26-year-olds would do in that situation. I ignored the symptoms. And what happened was eventually my very sweet Jewish mother guilt-tripped me into seeing a gastroenterologist. And shortly after a round of some intrusive testing, there was a lot of people touching my butt. The culprit was clear. I was told that I have a very aggressive form of Crohn's disease. I basically lived on the toilet. I had no choice but to bring all aspects of my life into the bathroom. I did work calls on my cell phone while sitting in the toilet, or on the toilet, not in the toilet. That would be gross. Over time, I was really scared to death about how much blood I would lose and how much kind of ended up in the toilet. That was always scary to stand up and look down and see all that. At one point, when it was near its worst, I went to the doctor and they checked my blood pressure, and my walking around blood pressure was 80/30. And they really didn't know how I was even standing in the doctor's office. In early May of 2011, my goddaughter was born in New York, and I got the okay from my doctors in Austin to travel. After about 5 hours of being on the ground in New York, I was back in the hospital, and a surgeon informed me that they would have to open me up and kind of see what to do from there. I thought when they told me they were going to open me up that, I was going to get my stuff together while in New York, and then I would go back to Austin and I would, get work kind of laid out and get all my things in order, and then I would go into surgery. The surgeon, who was an amazing surgeon, at that time brought a chair right next to my hospital bed and very calmly and collectively said, Mr. Ginsburg, I don't think you understand. You have this disease and it's beating you. And despite your best efforts, you're losing from this disease. You're actually dying, Mr. Ginsburg. I still have active Crohn's. I can't eat raw fruits and vegetables. I don't even eat very much cooked fruits and vegetables because it usually hurts. Who would have thought that eating fruits and vegetables was such a dangerous thing for somebody? I work hard. I still work 40+ hour weeks. When I come home from work, I go to sleep. I don't know that I'll be able to maintain this job forever just because of how much energy I have to put into it. I'm 28 years old and that I hopefully have a lot of life to live.
What feels really wrong is that our healthcare system is built on people making money off the fact that we get sick and that we need care.
And when you feel like you're dying or you're that sick, you don't care how much money it's costing at that point.
Medical inflation is unsustainable, and everybody knows this, but sort of like the national debt, we rediscover this every few years. And all of a sudden it's a national crisis, and then we forget about it. If you look at healthcare costs over the last 30 years, medical inflation outpaces regular inflation, and increases in wealth over, say, 10 years have averaged 30%. But if you look at the last 10 years, healthcare costs have gone up by about 68%. So we've almost seen the increase in healthcare costs eat away at the increase in wealth in America.
I'm concerned about the quality of our healthcare in the United States. I grew up the daughter of a neurosurgeon who was passionate about healthcare. He was the type of doctor who, after his patients were released from the hospital, would make home visits to check in on them, to make sure that they were adjusting again. When he had a client who couldn't pay him, he didn't charge. We've taken a huge step away from that mentality of health care being something that we all need.
One thing that frustrates those of us that practice medicine more than anything else is when non-doctors are making decisions for patients about clinical matters. When doctors are saying, I don't feel like I control the delivery of care anymore. I feel like I'm relegated to this one small piece, this one stop along the chain of stops that a patient makes. That's a scary process. In any industry, when somebody says they don't feel like they have control over the product anymore, or the service quality is out of their hands, that's when the industry is in major trouble.
My name is Frank Joseph Sage. This started when I was 25. Hit the bathroom one day and started passing blood and didn't know what the problem was. I had good jobs. I was working for the state. I went in to a GI specialist and they performed the necessary stuff, but my insurance would not pay for full colonoscopy. This is 85, somewhere in there. Back in the day when HMOs were, they were really ramping up and coming into vogue. There was a lot of cost cutting. They just didn't want to pay for certain procedures. GI specialist after GI specialist. My insurance was always the thing that, kept them from doing a colonoscopy. So I got a lot of misdiagnosis. I changed lifestyle, habits, all these things, and nothing ever changed. Sure enough, within 20-30 minutes, the problem started up. I went to the bathroom and just simply got up and shut the door, and I told the nurse to go look in there. And when she did, she was, quite concerned. Went and got a doctor. That doctor got a couple of other doctors. They all stuck their head in there, and By the time it was all said and done, I had a group of 7 doctors, and they shipped me up to the GI lab upstairs. Right at that time, they did a full colonoscopy, found the tumors, and had me on the table 7 o'clock the next morning. They said if they did not perform the surgery, I probably was going to bleed out somewhere in 3 weeks, 3 months, something like that, but it was going to occur. By the time I had that emergency resection done, I had no more insurance, no more COBRA. I was working a job for approximately $500 less a month than when I started when I was 17. And I was living in an apartment, bartered through work, so I could have a job and continue to work, so that's crazy shit there. But people fall through those cracks all the time. Unfortunately, it is the people like me or the people without insurance and whatnot that get the referrals to the people that can treat them, and they can't get anything done because it comes down to money. You guys want to make a profit, or you want to really do what it says, provide some health care. And often it goes back to money. I don't get it, but, that's because I'm on the other side of the fence permanently. I don't have a choice anymore.
We have a system that's so complex and it has so many different jobs. They're doing their jobs. The problem is the jobs are designed wrong. It's one of the only industries where the focus is not on the customer, it's on what happens as a result of the system to the various stakeholders.
They're duty-bound by their profession to treat you. And on the other hand, their hands are tied.
A lot of us have relinquished the control and power of our health to someone else. And the someone else is either an insurance company or government, and even the doctor, right? I mean, it's your body, it's your health. You need to be accountable and responsible and empowered to take care of yourself.
My name is Sarah. I went to eat with my parents at this really great burger place, and I asked for a strawberry milkshake or something, and they made too much. So they brought my big old huge one over and the rest that was in the metal cup. And that's good, you wouldn't normally get that. So I drank almost all of it, and I just remember that night sitting there in that booth and telling my parents, I don't know what's wrong, I feel like I have the flu and I'm gonna die. Next day the doctor got me in. I just really didn't understand. I was like, diabetes? Like, why would I have diabetes? How do I get diabetes? Nobody in my family's diabetic. Everything was good. My numbers were good and all of that for a while. But it's basically a honeymoon phase, but it doesn't last, which is what happened after that. And my doctor saw me and he's like, well, you look pretty good. I was walking around, I could talk straight. Because we're probably just we're gonna do one more like a serum blood test and see what your blood sugar is, and we're gonna let you go home. When they got the result, it was over 1,200, which is extremely high. Like, most people would have died with that or been in a coma. A lot of people wanted to tell me that, you might have 5 years before you start getting the complications of diabetes, and they talk about how many people go blind, and I had this real fear of sleeping because I didn't want to wake up blind. And at that point, for several years, I had had issues throwing up. I mean, I may go 4 or 5 days in between, but it was at least that often, and a lot of times more. I just got really good at throwing up. I mean, I had to do it when I was working. I had to throw up a lot. I mean, dating. It's like, oh, hey, we had so much fun with you throwing up every single place we went, and in the car, at least you were prepared. I mean, and I'm always surprised at the capacity for people to be understanding about that, because by the summer of 2009, it was really bad. It was so bad. I stopped holding massage appointments before the summer, or I think I stopped around January 2009, because the only way I knew if I could do it was if it was right there. If I was ready, the person was there, that's as much as I could confirm. I became extremely malnourished. My hair really was just falling out. So I just wrote a list of the things that I was experiencing that just didn't seem right for some reason I couldn't explain. And I said, well, the several ones I looked at, they all say acute kidney failure. And they're like, no, that's not it. They feed you radioactive eggs, and then they, just keep taking pictures of your just the digestive system to see like how long it takes to get out of your stomach. They just didn't do the test right. I just kind of would tell some of the doctors, I'm like, well, is it enough that I'm throwing up food I ate yesterday or even the day before? So there's 5 stages of chronic kidney disease, and the first time I found out I had any, it was stage 5, which is like, I found out from my nephrologist, and the nephrologist is the kidney specialist, that I would need to start dialysis. I never wanted to think about dialysis. That was like just one of the scariest things I could think of to have, and it hurt my feelings that I started going to that nephrologist, not because I had kidney damage, but because of how extreme things could be. They wanted me to be followed by the kidney doctor so that, so I would know. Like, we wanted to find out as soon as possible so I could change things and not end up having ESRD, which is end-stage renal disease. I was diabetic until a little over a year ago when I got a transplant for my pancreas and my kidneys. So of course our joke is about having a full house because they leave the other organs in. So I literally have 3 kidneys and 2 pancreases. I have boxes of this stuff at my house and at my parents' house. I just brought some of this because it was in like one place. And this is some of my medical records. Most of these are from around 2005 till now. It's not even half of them though. That's just one office. It's my lovely folder system. And then I want to show this to Social Security, who said basically the things I've been through, they don't see how that has had any effect on my ability to work. This was upsetting that they turned me down for that several times, just like it was upsetting to find out that the nephrologist had failed to tell me when my kidneys first started failing.
We have seen the problem of medical errors talked about to death. We have got this problem that's been studied, analyzed, talked about, and yet a lot of the recent studies show that we've made almost no progress in the last 10 years in medical mistakes. As recently as 2 years ago, the New England Journal of Medicine has reported top-level research that shows that as many as 1 in 4 patients in a hospital is harmed in some way from a medical mistake. In any other industry, if we messed up 1 in 4 times that we delivered a service, it would not be considered tolerable.
Yeah, the one that I was looking at the other day, I opened one of these, and so the bill was, my part that I was responsible for was, 1,000 and something. But since I had secondary, they paid it, and it cost them $10, and that was settled. The highest it got for me was over $700 a month. And I think now, the last time I was on the insurance, it was like $618 a month. So my grandma paid that for me, because it was a big deal, and she saw how much that was an issue, and so she paid it. And then after she died, she left, an account on that was for that, to pay that out. My credit report is 100% unpaid medical. My parents are retired. James, that's who I was married to, he would have to go back to Leander and work in the salon that we were trying to sell it, but so we weren't making money at that point. And due to a lot of things, doing a large part was the state of my health. It's closed in July 31st will be the last day that we are in there about doing anything. And I really haven't been there at all, actually. So it needed to happen a while back, but it is kind of depressing. Anyway, I'm sorry. Well,
my mother, for example, was treated for a number of conditions over the last 8 years of her life, and one of which was a heart condition, one of which she was taken in to a mental health clinic, and then she was transferred over into an alcohol rehabilitation center. And so by the time that she was in the hospital the final time with liver failure and kidney failure, and the doctor happened to be the same ones that had treated her for the previous conditions, and they told us point blank that they were not going to try some higher risk and higher expense treatment options, because that the kidney and liver failure were an result of her failing to comply with the heart treatment options that she was given, and then furthermore the alcoholism and the mental health issues that she had been having. The only options, which would involve a slow-paced dialysis, weren't even going to be offered to my mother, and that essentially we would just have to watch her die over the next few days, because the doctors essentially told us they didn't want to waste any more time with her. The other options would have been covered. They involved a very slow, 24-hour dialysis process. It involved blood transfusions, kidney transplants, and they just essentially said, we don't want to try them because of her other issues that we've been treating over the years. The success rate is too small, and so we aren't willing to try them, and we're not going to give you the option. And so I would have been more content if they had just never told me that the options existed, you know? Yeah. To be quite frank, it was like, so you're just going to let her die, you know? Then why are you even letting her be here in your hospital? Are you treating people, or is it just a financial equation that you're working out? And I still wonder what the result would have been if they had been willing to try some of these other options, and not, she was on insurance, so the hospital wouldn't have got hardly any benefit out of it. So it was a very despondent feeling, being completely helpless in that situation and watching someone die.
you can be fine one day and the next day you're not at all. And that's part of the issue with the insurance. That is kind of, it's disheartening. A lot of the issues surrounding it are disheartening to me, but it's because I've seen a bunch of extreme things that happen. In my experience, I mean, people of all different, backgrounds and religions and belief systems and everything, but they could still get together for a common cause. Like I would think healthcare should be. It should be a common cause.
My name is Kelly Quinney. I'm a marketing director for a restoration company. I suffer from quite a bit of chronic pain. The chronic pain started, I think, maybe at birth, since I've been told that part of it is genetic. Some of these things, apparently it takes 20 plus years for them to manifest, so you don't even really know what all is going on until kind of later in life. I can't remember a year when I have not met my deductible, which is $3,000. I had a lot of series of tests as far as nerve testing, things like that, very painful procedures to kind of figure stuff out, and basically it was, things aren't really good. We don't really know exactly what's going on. At one point I had lost feeling in my right arm, so this particular neurologist that I saw at this time put me on a substantial amount of medication, and I didn't really question it. It just, I I kind of thought she's a doctor, she knows what she's talking about, and not just a doctor, but a neurologist, you know, very smart doctor. I just, you know, very naive. I get a letter in the mail from Merck, I believe, that said Vioxx has been recalled. It was apparently killing a lot of people. Said to immediately cease taking that, you know, take some back. They gave me kind of directions, whatever. So I kind of freaked out a little bit. So the commercial said, have you or anybody you know committed suicide or attempted suicide while taking Neurontin? I remember thinking like, what the Vioxx that I'd been taking was recalled because it was killing people, and then I had been prescribed something that was not approved for that by the FDA, which unbeknownst to me, most drugs are provided without FDA approval for what they're prescribed for. So I didn't realize there was a big loophole there. Apparently that's not a required thing. You don't have to be FDA approved to prescribe for something. So I called my doctor's office and I was pretty upset. And I really didn't get any kind of consoling or anything like that. It's okay. It was just combative, a lot of defensiveness, kind of that God mentality. Like, oh, well, dare you question this doctor? And I really hadn't questioned anything until at this point, and then I had good cause. And at that point, I just kind of decided no more of that. Think about a lot of the drugs that you're prescribed. The side effects then require another drug to be prescribed. I mean, I remember when my grandparents passed, we went and cleaned out their house. You could have opened a pharmacy with just what was in there alone. Blood pressure medicine that caused nervousness, so they had to have, I mean, this had to counter this. This caused diarrhea, so then they had to be on this, and then this caused that. I was pretty much done with meds. I decided that I would try to seek alternative methods. I'm at my breaking point. I'm driving down the road one day to work, and I remember thinking in my head, if this is the way my life's gonna be, I don't want to really be alive. After all this money, all of these tests, all this stuff, no one's really been able to tell me what's wrong. It could be this, you know, the body's blah, 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 blah. They're so sure when they do it, then it doesn't work, and all of a sudden, it's no one's fault. And the thing is, I don't really care. I just wish they'd stop telling me how much better I'm gonna feel. I was referred to a homeopath by a friend of mine who'd gone to this doctor who had helped her tremendously. He's also a hormone replacement doctor. He's an MD. He did a residency in psychiatry and one in general medicine, and he's a homeopath. The thing about that, the fact that he was an MD, meant that a lot of that stuff was covered under my insurance, those testing. Being able to prescribe those tests, it was a great combination. Being able to utilize Western medicine for the testing and things like that, but then to diagnose from a homeopathic standpoint. The thing is, homeopathy was the way medicine was practiced for many, 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 many years, and it's just completely gone by the wayside. And now they're considered quacks, when it hadn't been that long ago that was your doctor, was a homeopath. I've found now through going through homeopathy, symptoms are your body's way of fighting things off. And you've got a rash, if you treat it with something that makes it go away, it just pushes it down. It's gonna come out one way or another. It's gonna come out sideways. It'll come out 10 years from now, and it'll have something else attached to it, but it's gonna come out because you don't treat what's causing it. You could be eating something every day that's making your skin break out. Well, you can give yourself Benadryl or put some itch cream on it, and it'll stop, but it's still gonna bother you because you haven't taken away the source of the problem. And that's not something that Western medicine really teaches.
The majority of the healthcare system will do things like surgeries, medication, things that are basically like putting Band-Aids on big, huge gashes. Without solving the root of the problem, you will eventually be back. Maybe not directly to that doctor or facility, but you will eventually be back for something else at some point in time without solving the root of the problem.
After having gone through the whole, run the gamut of injections, the shoulder surgery, and then still having neck problems, and the shoulder surgeon saying, sorry, not my fault. Throughout this time, I start seeing an acupuncturist, an herbalist, and start getting more involved in nutrition. All of this stuff is coinciding, together, because I'm trying to do a little more holistic approach to everything. I've had great success with that. I've tried multiple therapies, but that's been one I've really had great success with. It is not covered by health insurance. I did, however, have a neurologist that saw it as a benefit, so she prescribed it. So in that, I could send a receipt off, and then it was kind of left to the insurance company to decide whether or not they wanted to pay it, which of course they did not. So the things that I am getting some results from, as far as the holistic side of things, the homeopathy, where I am actually getting results and feeling better and venturing down that road, that stuff is not cheap. You know, and it shouldn't, I'm not saying it needs to be, but the fact that healthcare won't even acknowledge that, it's pretty much most of my expendable income has gone towards alternative medicine. So I'm averaging about $10,000 a year, maybe a little bit more, out of pocket, in addition to my deductible and all those things, for the last 3 years consecutively on homeopathy, things like that. Supplements, this, just the next thing that's gonna help me and make me feel better. I started seeing a doctor on a regular basis. The problem was I couldn't afford the treatment as much as I needed it. I mean, it was helping, but I was forced again to, not be able to afford it. And mind you, this entire time I have been working. I have not been without a job since I was 15. So I've always had a full-time job and a good job. Just these things that I really needed, that I was finding success with, they were unaffordable to me because they weren't something that was covered under my insurance. So I had kind of all the things I had to pay for, all of my regular bills, and then this stuff kind of on top of it. So I had to choose what to do, and that alternative healthcare wasn't affordable at the time for me. We're so in the dark ages about this kind of stuff. It baffles me. It baffles me, with as advanced as we are in so many things, and we're just so ignorant to things that just seem so obvious to me.
We haven't been thinking about alternative care, about other treatment options, about the role of diet and exercise, about the impact of genetically modified foods and the high sugar content out there. These are not things that have been on our radar in American medicine.
I can't even remember a nutrition class in school, ever. I remember being served shitty food on a plate in a public school, a square of pizza, and pizza day was like the great day. And then we start getting educated about it, like, oh, maybe there's something in the crap that it's not our parents' fault. They didn't know any better. They feed what they can feed us. That's just the way that it is. It's an education thing. But now we know too much to not know. And it's like that, once you know, you can't not know. There's just all these things that that's never even addressed. It's just, well, here, I'll just give you this and you'll feel better. Or I'll give you this and you should feel better. But if you don't, hey, it's not my fault. That's the frustrating part about it.
It's never so much the form of medicine, it is as the person who's performing the medicine. So if it's Western medicine, if it's Ayurvedic medicine, if it's acupuncture, if it's massage, naturopathic, they all have incredible strengths. It really is more about what is the professional how are they delivering the medicine, and what is the rapport between the people. I was really sick in California back in the late 80s, and a friend of mine had told me I should try acupuncture, and I laughed. I thought it was a joke. My father was a neurosurgeon, and I thought that if acupuncture was effective, he would know about it. So it was probably about 2 years, and he finally convinced me to go see an acupuncturist, and the results were really amazing. I became curious, and I thought, well, why does it work? What is it? And in fact, my acupuncturist at the time would get really tired of me asking questions, and she would kind of have to say to me, you have to accept the fact that Oriental medicine works on a totally different medical paradigm. It has its own laws, it has its rules, just like Western medicine does. It's just a different medical paradigm. I'd love to be able to get over the myth that acupuncture is quackery. If we could just let that go, forget about it. Because a lot of the studies that are done that are claiming that acupuncture is quackery, it's really hard to establish the kind of double-blind study that that would the people are basically saying, well, therefore it doesn't work. But the proof is in the years of service that acupuncture has provided for people for thousands of years.
We're going to ignore something that's been successful for thousands of years. How many? I don't even know how many. And for something else.
When I first got my license, I moved from California, where of course acupuncture was considered a primary form of healthcare, and I moved to Maine, where it was not. However, a lot of insurance companies, in fact, when I had my practice in Maine, I was a provider for 2 HMOs, and all of my clients had insurance that covered acupuncture. So I didn't have to sell acupuncture. People came to me, I treated them, I worked through their insurance, and it was fine. When I moved here to Texas, it was an eye-opening experience because no insurance covered acupuncture, and it was a whole different way that I had to approach. I mean, ideally, if somebody has a resonance with acupuncture, if they know that it makes them feel better, if they can discern that after an acupuncture treatment they feel calmer, they feel more balanced, then that's the type of person I'd say, don't just do it in those emergency situations. Make it a part of your regular health care. Get it once a week. Go to a community acupuncture clinic where you can pay $20 for a treatment, and make it part of your regime, because if you take care of yourself on a regular basis, and you can allow your body to experience that sense of peace, of well-being, that's what good health is all about. And the more you allow your body to feel that sensation, the more you remember, oh yeah, this is what life is supposed to be about. When I'm working with someone, I try very hard to make sure they understand, I'm not going to tell you. You need to be giving me feedback. I've seen acupuncture, giving an acupuncture treatment, and boom, I won't have to see them again for 4 months. And then they'll call me up and say, well, gosh, I'm in a lot of pain again. Okay, let's get you back. Now we sort of know what the perimeters are for you. And my father was a neurosurgeon, and he had told me once that he could tell when somebody came through his door in the first 5 minutes whether or not he had a chance of being able to help them. And it was just a question of whether or not that individual believed that he would be able to help them. There have been people who've come who've been very skeptical, who said, prove it to me. Okay, yeah, right, prove it to me. And sure enough, they're like, oh, wow, okay. The pain, it's gone. I wasn't expecting that. In all honesty, I don't do acupuncture because I looked for it as a way of money. I fell in love with acupuncture because it helped change my way of looking at my own health. It changed my way of my body and my brain, the communication. It was established. My love for acupuncture has nothing to do with the fact that I'm an acupuncturist.
There's an effort now in medicine to talk to patients about all the risks and all the options. It's called the shared decision-making movement, and it is an awesome trend in American medicine. We're seeing a generation of students and young folks rise up to say, why can't we be more honest with patients about their treatment options, all the alternatives, and how well we perform? In Western American medicine, there are some things that we do very well. We do emergency care very well and trauma care. But when it comes to chronic diseases, when it comes to alternative care, when it comes to borderline conditions that may or may not need treatment and we need to determine the appropriateness of doing things, it's something that we have not yet mastered. When is a headache that needs an MRI? When is somebody's pain something that can be treated with a medication, or when is it something that can be treated with a massage and some warm weather? When is depression something that can be treated with a change in social scene, and when does it need a medication? There are a lot of good treatments out there in American medicine. We have some of the technology that marvels the world, and our research is the envy of every country out there. Yet the sense of appropriateness in applying modern medicine to patients is something that we're still learning. We're still in our infancy.
One of the reasons why I chose to become a nurse, I lost my job and became very sick. I could not find out what was wrong with me. I became so overwhelmingly sick that I made myself even more sick thinking about being sick. Tests were run. I was in and out of the emergency room 5 times. I had a colonoscopy and an endoscopy done. 2 weeks later, she asked me to come back in for the results and discuss them with her. And she looked at me and she said, "We cannot find anything wrong with you." She said, "I want you to see about talking to a counselor." I only had one meeting with this counselor, and by the time I left, I realized what was making me sick. And the truth was, it was me. That 15 minutes each time I paid for those doctor's appointments did nothing to prove to me what was going on. I felt like I was going crazy. I felt like I was sick because no one could find anything wrong with me. I just wish that in our industry, somebody somewhere would have stopped me and said what I needed to hear, which is that there is nothing wrong with you that we found physically. And I think what you need to look at is this anxiety level that has been plaguing you since you lost your job and the stress that you have. And I may not have been sick for 3 months. I may not have spent all this money going to all these different doctors and these ER visits. The bills for my ER visits, they were overwhelming. But in my mind, I knew that there was something wrong with me, wrong enough to go in debt.
Your partner can ask for a divorce. You can lose your job. Your company can get sold. Lots of things that just begin the cascading down so you feel like you're underneath the world instead of on top of the world. When that happens, you're stressed out. When you're stressed out, what happens in our bodies is the adrenaline rushes to the arms and the legs, and we lose it in our hearts, our vital organs, other vital organs like our kidneys, our livers, and our immune system decreases by as much as 1/3.
Your body can only deal with so much, and whenever you're burdened with such serious anxiety, it has ways of showing it. This is our body's way of telling us there is something wrong. It may not be something physical, but there is something wrong. And mental health is just as much a part of physical health. They are tied so closely together. Your body has the ability to do things without you even knowing.
It can happen to anyone at any time. I see people that come in that have mental health issues and they're trying to solve it with marijuana, with harder drugs, with alcohol, over shopping, overbuying, stuffing food, just getting fatter, just trying to heal the wounds that are there in ways that are accessible but don't solve the problem and just create a second problem.
Both parents, real stable, real normal, super strict. I have 2 stepsisters, and they both went to college, got married, have kids. From the ages of, I want to say like 11 to 15 maybe, I was a cutter. And then just like it progressed and progressed to where it wasn't cutting, it was like a suicide-y, like suicidal ideation at least anyways, and then being extracted from homes for suicide, pretty much. So I've lost a lot of friends over the depression thing though.
You have?
Oh yeah.
How's that?
They're sick of dealing with it because I'm always like, oh, I'm freaking out, you know, and they're just sick of dealing with it, which I understand, you know. I was on my parents' insurance till 25. Is the cutoff, I think. And so I'm about to be 29 now. So I've had this 4-year window where I just haven't gone to the doctor. I've been plenty sick, and I found out actually in the last 2 years that I have hepatitis C, but there's nothing I can do. There's nothing I can do. I went to jail for 1 day or 2 days. It was for like a bad check I didn't even know I wrote. All my meds and the state paid for it. I paid a $20 PR bond. If I could pay a $20 PR bond every time I got all my meds filled and that would last me for like 6 months, I would totally go to jail for a day or 2.
And you feel mental health is not a part of that?
Mental health doesn't even like mental health, I think, is probably like laughable to doctor, you know, like, well, they're like that because they want to be like that. Or like, you know, they're like that because who cares? I'm not thinking about it. It's not cutting my paycheck.
We never sat down and went through any resolution of anything. It was just like, here, just take these things. And then a lot of it was, we just need to find the right cocktail for you. You know, we just need, so it's this up and down, in and out, off and on this drug. And to the point of, you know, some days you're completely insane. And some days you're kind of okay. And then others you just don't really feel anything. You sleep or you're awake for 3 days. I mean, it's just this massive roller coaster of, okay, that one doesn't work. That one doesn't, I mean, thank goodness I came out of the other side of it, and some people don't going through that. I mean, some people, you get the wrong cocktail and that's the end.
I don't know. I feel like people with mental issues usually can't hold down a normal sit at a desk where you make 60 grand a year kind of job anyways. Those are the people who have health insurance, right? It's the people who are content doing this thing. Us over here, the mentally sick, deemed society, can't afford it, A, and B, we don't care until it's too late, you know what I mean? I wish people would just listen, you know what I mean? I feel like even if you do, I don't know, I'm weird in the fact where it's hard for me to ask for help anyway, but if I do, I'm like real serious. And I feel like it takes forever for, like, till something happens already for somebody to be like, oh, she was serious. We should probably do whatever, call an ambulance, yappity yap, because I'm never going to do it on my own. Just because I don't want, any more financial burden. Because if I die, that all goes to my family, who's had enough burden on account of me. I'm a hellraiser. You know what I mean? So, like, and I think depressed people already think about like stuff like that anyways, like I don't want to be a bother to anybody, I just kind of want to do my own thing. But then we never think about like how our actions affect other people. Hey, I need help. Is that word help that I know I'm not going to get it, or I'm just like really pessimistic, I guess, when it comes to it?
It gets very, very difficult to get the kind of support that you need. When someone gets sick, they can't afford to go to the doctor, so they go to the emergency room, which costs all of us big bucks because we're trying to support the hospitals through our tax bases.
The EMS trip alone, I think, is like $1,000, and that was from here to that hospital that's right down the street. They had an itemized bill, and it was like a Tylenol with one, not even both, that you're gonna need, was $7. So am I paying the extra $6 for them to walk to the cabinet, or? I mean, they can't expect that anybody's gonna ever pay that back. Especially the people who don't have insurance don't have it for a reason. It's like the poor stay poorer because we can't ever not, you know? And like we usually have like a bunch of health ailments, you know? Because we couldn't fix the one previous to whatever is leading us there now or whatever.
The latest research is if your family of 4 has less than about $42,000 a year, they're going to have mental health problems. We need to work for all of our mental health. That is a fundamental aspect of being a full person.
I mean, like that guy in Connecticut, he had problems, and they let him go without taking the time to help this guy out. He could be just like us. You know, we're capable of snapping like that. You know, it's a touchy subject, but it is what it is.
I have state-funded insurance, which means nobody takes it.
Right? That's about to say, good luck finding somebody to accept that.
Yes, which means nobody takes it.
Oh yeah, you got Medicaid.
Yeah, I got Medicare. It's okay. And what does that mean? You know, absolutely nothing. Like I stayed 6 days in the hospital, and even with my Medicare, it cost me $45,000. That's what the medical bill said. I was like, really? I've called just about every psychiatrist here in Austin, and the ones who are taking new patients aren't taking Medicaid because Medicaid's not paying them. Like they bill Medicaid and they never get anything back, so they stop seeing all the Medicaid patients.
But you can't blame them. I mean, if I was in that position, I would be hesitant because, I mean, that's my job.
I want to go to school so bad. I want to be able to help myself. I want to be able to make money to where I can pay for my own prescriptions. And yet I can't. I'm living off the government because they won't give me my medications. It's kind of like a big circle, and I don't understand why they just can't give me my medications to where I can go to school and I can make my own money and stop taking money from the government. I don't want to be on SSDI. I don't. It's not my... I just want to do this for the rest of my life.
Yeah.
I want to make $707 a month.
Right, you're not the stereotype.
I'm not, and I don't want to be. They've given me something called Rosarum before, but I can't afford the medication. It's way too expensive. They don't make a generic in it, and my insurance won't cover it. It's like $500 just for that particular one.
A month.
A month.
And you're 22.
And I'm 22.
That's rent. Yeah. It's rough, you know. Like I pay my own insurance. I pay everything I can, and you have to choose whether you want to be productive, as what people call a productive member of society, or if you're gonna, handle your mental situation. I went and checked myself into what was it, Seton Shoal Creek or whatever. Shoal Creek, and I was there for 2 days. Before I told them, I was like, we got to get out of here. Because they would charge me $1,700 a day to be there. And I had to lie and say I had no insurance to get in because they wouldn't take me if I had to. Because my insurance, they don't take that insurance. And I came all the way from Waco to do it, to go and take care of that. Because Waco was like, no, we're not here, I'm sorry. And I had to lie and say, I'm suicidal in order to get in there in the first place, even though I wasn't.
And what were you going in there for?
To get back on medications and stuff like that, and it was ridiculous. We're ruining our credit by doing the necessary actions that we must take in order to be normal and to take care of ourselves. But in the end, we're not going to be able to get anything. No, that's no new car loan, that's no loans, that's no house payment, nothing. And because we're being forced to run our credit by running up these medical bills. Money's hard to come by for anybody in that situation. I mean, whether you make $150,000 a year or you make, $20,000 a year, your money is tight regardless right now because of how the times are. It's more money, more bills, and that's just how it works.
When people are income is fluctuating, then many times they can't afford the antidepressants or anti-anxiety. So they can't, if you can't get your body working in terms of anxiety and depression, what happens is the will to do anything is gone. If there's not intervention, it begins that cascade effect down and down. That's who ends up eventually, we could all end up homeless. They figure statistically, it's about 89% of the homeless have a mental illness that was not treated earlier. And that's why they're there. That's why we could be there. To me, these are symptoms of drug abuse, alcohol abuse, obsessive shopping, etc. That's just a symptom of a problem.
And you talk about psychiatrists not seeing new patients, like it took me forever to find someone that would even see me, because or that even takes insurance. A lot of them won't take insurance. For an initial visit, I think I paid like $180 or something, just for the initial, they spend extra time with you, getting to know you, I guess. I don't know. I've been like seeing a psychiatrist since I was 15. I have my records. I can just give them to you.
And what about therapists? Do a lot of therapists take insurance?
No. Psychologists, not at all. That's pretty much out of pocket. There's places you can go here, like capillary counseling, where they have sliding scales and stuff, but you're getting usually people who are like social work master's students doing their clinical hours. So your quality of, counseling, it varies really widely. I don't see a counselor now because I tried that capillary thing and I was just like, no, this is not what I need, so.
So you would if you could afford it?
If I could afford the kind of therapist that I need, then I would go, but I'll just write in my journal instead.
How much does that cost?
Depends on if I get a fancy one from Barnes and Noble.
I feel like it's, I don't know, why would they want to make poor sick people better? You know what I'm saying? Screw it. They're poor sick people. Let them be poor and sick. It's not our problem. You know what I mean? Now, if I can make money off that sick person, well, let's make it my problem.
We're at a very criminal state as a society for the way we're treating each other. If we look at comparison of what our mental health services are with other industrialized nations, what we see is that we are at the bottom of happiness indicators. So we are about the least happy of any country in the world, given the amount of resources that we have. Here, people are scrapping and they're frightened, and it makes it worse. Mental and physical health are part of the same body. So when our physical health is not working, it influences our mental health. If our mental health isn't working, it influences our physical health.
If you look at where the resources are devoted in American medicine, the squeaky wheel gets the oil. The groups with large lobbying efforts get tremendous resources allocated to things that affect them. Patients with schizophrenia do not lobby Congress, and they do not get a large amount of money dedicated to research for schizophrenia or reimbursement for schizophrenia.
Like, how much do we pay in insurance over an entire year, and how often do we end up using it during that year? If I've added up this much money throughout the entire year, like, why don't you just pay for the whole thing? I mean, if you've gotten, like, you know, thousands of dollars from me over this, you know, period of time, and I've never used it, but I go in and you know, like, my bill ends up being, you know, $2,000. Why not pay the whole thing? You know, like, I mean, you guys have my money. I've been giving it to you. What have you guys been doing with all the money I've been giving you?
That money.
Exactly.
Yeah, true.
I think their answer might be that someone else got sick, and so you being healthy subsidizes something that happens to them because it's a risk pool. But then
we blame each other.
But then it's like, yeah, okay, so
I think for the premiums, like when I used to pay for insurance when I had a company job, I think if you don't use your insurance, as you say, you never use it, compared to somebody who's always either abusing the system or using the system, there should be a payment difference. I mean, if I'm not going to use my insurance, it should be way lower than somebody who's going to use it every 2 months.
Or build up credits. Like, I'm totally cool with the idea of, like, I'm paying in, but I'm paying in because I'm going to have a certain amount of money later on, so that if something catastrophic does happen, I've got this credit going towards that. Like, why wouldn't it work that way? Where is all this money going? I think if that kind of stuff was just, like, out in, like, public record and people could see that, maybe some things would start to change, because it seems like there is a whole lot of passing the buck, and, well, it's not us, it's the insurance company, well, it's not the hospital, it's, you know, the doctor, and they just keep playing this game, and, like, obviously nobody knows who's making the money, and so why not?
So how are we going to do this with me eating?
Be natural, eat, enjoy. I mean, the food is, I'm hoping, very delicious because the place looks awesome.
Oh, it's good. You'll like it. I'm Jeff McPeters with Group and Pension Administrators. Everyone calls us GPA. We're a third-party administrator that pays health claims for employers that have, you know, 50 to 100 employees or more. And we have really stirred it up with the hospitals all across the nation. The PPOs, which is basically what is insurance now, so PPO is a preferred provider organization that has, you know, a group of hospitals or doctors that they say you're going to get lower prices by going to those, you know, those hospitals and doctors, which over time every doctor in almost every hospital's in the PPO, so there is no preferred provider anymore. We've added up the profits for Houston, San Antonio, Austin, Dallas, Fort Worth, Austin, for example, has 20 hospitals in that area, in about 25 square miles. And in the last 6 years, they made close to $13 billion in net profit. They'll say, oh, so-and-so insurance company made, $1 billion or $3 billion. Well, that's an insurance company all over the nation in almost every city of the country where they have lives, yet you go to one city and you add up all the, for like Dallas or Houston or Austin, you look at all the profits that one hospital, those hospital systems made, they made over $1 billion just in one city. And most of them are not for profit.
Some of the hospitals are crushing it right now. They're making a lot of money, and they've got a nonprofit status that allows them to keep the money and use it to grow. Well, just because you have money, that's not always a reason to grow. Sometimes you need to think about the need of the community. And we know from our research out there that when you have more health care being provided, more gets done.
We went to a website like AmericanHospitalDirectory.com, and we were looking at the financial statements that the hospitals have to give to CMS, Centers for Medicare and Medicaid Services. If they take a Medicaid or Medicare patient, they basically have to open up their books and give that to Medicare. The doctors, we realized, are not the problem. In fact, most studies that we have seen show that doctors per service now make less than what they did 10 years ago. What we found is the insurance companies, they're now partners with the hospitals. There's so much money being entwined between the insurance companies and the hospitals that 10 years ago they never would have said they're partners. We hear it all the time now that the big insurance carriers say, oh, that's our partner hospital system X or our partner hospital system Y. Sometimes the insurance companies are even telling the hospitals, here's what we want you to bill, so that they can make their discount look bigger. A $77 charge for one gauze pad that costs less than a nickel. And even if you get a 50% discount, which that's what you get with a lot of these PPOs, you're still paying $35 for one gauze pad. And they say they're not making money. These hospitals, they'll look in the eye and say we're not making money, because we've been in negotiations with a lot of hospitals, and we say, well, what you reported to CMS, you made $325 million last year, and they're always, well, it's the same script that we always hear. Well, we have all these uninsured patients that we have to take for. Well, that's built into all these huge profits that they're making. There's brokers out there, independent insurance agents, and I say independent, that won't sell this program because, number one, the insurance companies are threatening them, saying if you sell with them, we're going to cut off your bonuses and overrides and everything we pay for you. I've seen that happen. So they're basically, I don't want to say if it's blackmail, but it's close to that for these smaller insurance agencies. They're like, that scares us. And some of the larger insurance agencies, they're making so much money from the insurance carriers that they won't sell our program, because if they go to ours, because we don't pay the big bonuses and everything like to the agents like some of the other insurance companies do, they won't sell our program. Now they're starting to get forced to, because employers are saying, why aren't you bringing this this program to the table? In that circle, you got the hospitals, the insurance agents, and then you got the insurance companies. Yeah. And you got that circle. And where's the employer and the patient? They're outside the circle. And they haven't been able to be in that circle for years. Yeah. And so, that's what we're doing, is trying to break up that circle.
My family, dealing with my mother's bills after she passed, we were finding consistently double billings from the same we found $6,000 that we would have had to pay, so equivalent of $60,000 charged that were true double billings where we were billed twice. And it was just wading through all of these, hundreds and hundreds of bills trying to figure out, and I don't even know if she received any of that care. She was in the hospital for 2 weeks, and we can't ask her if she received it or not. So it was just it's like you're trying to work through a grieving process at that point, and you're stuck with, piles and piles of bills and trying to figure out what the hell to do.
If you're getting double billed, they're getting double billed, and they're paying out, even more percentage of something twice.
Right.
You would think they would be interested in finding their the double billing as well.
In our industry, there's something called auto adjudication, which is the claim system just automatically pays things coming through all electronically, and no human being is questioning. If you get the list bill, that's where you can see all the services that we kick out that were not performed. Because almost every time we always find services that were never performed. There's an industry called revenue enhancement consulting, and those consultants teach those providers how to get the most bang for their buck and what the insurance companies will pay for and won't question.
When she was about 4 years old, she was bitten in the face by a dog. And so we rushed her to the emergency, and I get the bill later, and because I was by her side the whole time. And when I get the bill, he said he took x-rays, he did this, he did that. He put in like some stitches that fell out the next day. I'm like, you didn't even do your job right. But then I get charged for things that he didn't even do, so.
About 10 years ago, I had a kidney stone. Go in the hospital, and with a kidney stone, you tend to jump to the head of the line in terms of pain. They give you morphine, but they did the MRI. They did for the room and all that stuff, and then you get bills from the hospital, and from your insurance gets an explanation of benefits. But then all of a sudden you're getting a bill for an MRI operator who is off the plan, even though the MRI itself is covered. And I'm in the hospital thinking, am I supposed to shop around?
We founded this company called Snap Health. Chris and I are both ER doctors, and we saw a lot of patients coming to the ER as their only point of care. A lot of people were actually paying their bills, which was kind of a shock to us, because we're like, this is the most expensive access to care you could possibly use. Why are you using this? And their answer was, well, we don't have health insurance. Where else are we supposed to go? People feel like if I don't have health insurance, I can't get health care. It's like the dollar of health care, which doesn't make any sense. No one, there's no George Washington sign on the health insurance policy. So, you can pay cash. And honestly, it's more effective that way. When you use health insurance to pay for everything, it just increases the price of everything by 30 or 40%, because the health insurance company needs to make profit. They pay a bunch of people to set the rates, to reimburse the doctor, to do all the billing. So, we think there's a place for health insurance, but it should be more like car insurance or homeowners insurance, where something really bad happens, like your house burns down or you're getting a car accident, then it kicks in. But imagine if you used car insurance to pay for your gasoline and you tacked on 50% to every single time you went to the pump. So now instead of $4 a gallon, now it's $6 a gallon. That doesn't make any sense. And we're talking about like primary care visits and pap smears and chest x-rays, things that are affordable, and if not immediately affordable, you could finance over like a couple months with a credit card. I mean, we're talking about a couple $100. We're not talking about millions of dollars. How do you buy stuff really efficiently? Do you really call every single car dealer, or do you call every single TV store? You don't. You just go on Google or you go on Amazon, you surf around, you find what you need. We thought, why don't we bring that exact power to healthcare? Let's build a website. You can surf around, look for exactly what you need, whether it's a pulmonologist, a pediatrician, an OBGYN, it's all there. They list their cash prices. You know exactly what you're going to pay before you go, which is a huge revolution in medicine, right? Not only do you actually know what the price is, you can actually pay ahead of time and surf and shop and compare prices and quality and make a good decision for you. From the doctor's perspective, we made a win for them, because right now they're buried in paperwork. They spend a lot of money just getting paid from insurance, often with denials of claims, and it takes 30 to 90 days to get paid. So it's a win for the doctors, it's a win for the patient. Let's get rid of all the noise in between and go back to something that looks something like pre-1930s doctor-patient relationship, which is doctor and patient. What is this going to do for me? What's the benefit, and what does that cost? That's how you make healthcare affordable. I mean, the question is, why isn't it this simple? And in Texas, there's 25% of the state is uninsured. So there's a really large market here, and people can pay for health care. They just got to find an affordable price, and they've got to find a tool that helps them figure out where to go. Is the public ready for this? Are they ready to take the power of their own health care in their own hands? That's the real question we don't know the answer to. Are they ready to be consumers of health care?
These PPOs, they've been selling on the word discount, saying, hey, our discounts are so much bigger, so they're going to make your claims lower. And they've been selling that for 10 years, but yet, so the discounts have been growing. So if discounts grow, shouldn't claim costs be coming down? But it's not. It just keeps going up. And cash basis payers, they normally do get the best discount. I mean, they get very good because the hospitals, number one, they don't like having to go through all the insurance companies and getting reimbursed and all that. They love cash. Cash is king.
I've had to see some endocrinologists and some specialists that are really expensive to see, and one of the ways that I've been able to pay for it is to not pay my bill for a really long time until like maybe a year, and then call and say, okay, I'm ready to pay my bill now. I have $300, will you take that? Basically just negotiate my bill. And at that point, they think I'm never going to pay, so they'll take anything. And it seems very arbitrary that I'm able to do that, you know? Like if they'll just take, you know, $300 for me at some point, like why wouldn't they take that, you know, a year ago? Or why couldn't we like talk about it before? Why couldn't we negotiate beforehand?
A person on their own that doesn't have insurance, sometimes they are in a good, where they get the financial assistance, but some are in a bad position because they just can't negotiate or don't know how to negotiate.
And they're not just up and deciding, well, I don't feel like I'm going to pay my medical bill today. They probably can't. And if it comes to a point where they have to decide on their care, their treatment, taking care of their family, putting food on the table versus paying this medical bill, they're going to pay the medical bill. I think that a lot of the things that plague us as humans are preventable, and I think that people are uneducated about the truths in healthcare and the truths in our society regarding what we do to our bodies.
The doctors is very focused on like, okay, like tell me about what's wrong, let's get this taken care of, that's it. There's none of this sort of like, so how are you doing? Like what's your, you know, what's going on in your life right now? Like are you know, eating well? Are you taking care of yourself? Like what kind of stuff are you doing? Like preventative type things. I've never gotten that vibe when I go to a doctor. It's always about, all right, what are you here for? You know, let's get you in and out. Let's take care of that one thing. Not like, is it related to something else maybe? Like, unless of course it's related to more tests, because then they're all about that. Like, yeah,
I think the problem with our medical industry, there are good people working in it. A lot of the nurses, a lot of the doctors are very good. But the problem is that it is focused on the treatment. And I think there's not enough time focused on the prevention.
When you do something like that, you realize, oh wow, I have control. I can help myself feel better. I don't have to rely upon the prescription of a doctor. I don't have to rely upon a form of surgery. There are things I can do to take control over my own well-being and my own health. Our conscious choices about how we're going to approach something do play a part. You can't, the individual is not separate from the treatment. You can't separate the two.
The infomercials, the ads, this is what you need. This is the ab routine that you need. This is the kind of diet you need to be on. And God knows there's so many diet medicines, so many diet plans out there. Constant bombardment from pharmaceutical companies advertising medications that you should be taking. If you have this, and this, talk to your doctor about this medication. A company that makes money off of selling you a prescription is giving you a general set of symptoms that people probably have on a daily basis, and they're telling you to go talk to your doctor about this medication.
I remember being a kid having acne and going to the doctor and they start putting everybody on Accutane. Well, it turns out Accutane makes some people suicidal. But hey, you don't have any more zits. I mean, you want to kill yourself, but at least your skin's clear. I mean, it's just so irresponsible.
One of the only ways you can navigate the healthcare system today and thrive in it is to actually educate yourself about options, treatments, different places, the doctors to go to, the latest research.
We can't live as a society of children. We have to be a society of adults that are going to make rational decisions, be accountable, and make good decisions and make value-based decisions. You know, the analogy I make right now is healthcare is kind of like you walk into a restaurant, you have a menu with no prices, and someone else is going to pay the bill. I remember being 17 and going with my parents. I ordered whatever the heck I wanted because I wasn't paying. One of the things that's like kind of worrisome to me is that people need to value their health. They need to actually value it, right? It needs to be their most important asset. Because honestly, without your good health, like what else matters? I mean, who cares what car you drive? I mean, but the thing is, I don't think fundamentally people value their health, and there has to be an actual personal value and a financial value, because if you screw it up, it's going to cost you a lot of money, and people need to attach the two together.
You know, we get sucked into this mentality that I don't want to spend the money now because I don't know what's coming, you know, down the road. It could be so much worse, and the problem is it's worse now. You know, don't worry about this crap back here, and I think we all get shortchanged by that.
You know, fundamentally, you know, I went to medical school because I wanted to make a difference. What I'm finding is that difference is becoming less and less palpable in medicine, because it's all a bunch of policies and this is what you have to do because Joint Commission or Medicare requires it. And honestly, by the time many patients get to the ER, I think it's too late. We missed our opportunity to make that difference in that patient's life.
Does it make sense that we have lavish, expensive technology with no clinical benefit, and at the same time we're turning down patients in the same system because we simply can't afford their care? We can't afford to save their lives.
People hate the word activist because it, you know, sort of has this stigma of people walking around with picketing signs and stuff like that. But being an activist means that you are going to actively be part of the solution. And that's, you know, whether you're taking care of your own family or yourself, but you have to be engaged. The change won't happen as a passive process.
I was in a hit and run situation, and one of the first things they asked in the ambulance was whether or not I had insurance or not. And I said that I didn't. And it was in Houston at the time, so I went to Ben Taub Trauma, which is like, I don't know if anybody's ever heard about Ben Taub, but it's horrible. It's like super, like it's traumatic in itself. Like what's happening. There was another guy next to me that I almost cut his hand off or something and had it in a bucket and was screaming. And that one was crazy because they like walked over and they gave him like a shot of morphine or something. And about 5 minutes later, he's like talking and waving. It's like going everywhere. But then I got a bill from them and the EMS and the fire department. The bill from Ben Taub said that they'd given me like some kind of painkiller, like injections and stuff. I didn't get anything. I'm terrified of needles, so I would have known for sure if somebody had given me any kind of an injection. And you know, I called him back and I said, look, I'm not paying for this. Like you guys didn't do anything to me. He basically brought me in and stuck me in a bed with all this like crazy stuff going on around me, and I just sat there for 8 hours. I didn't talk to anybody. Like nobody would give me an answer of what was going on. They were just like observing me. I mean, that was my experience, and I think it was because I didn't have insurance.
There's different desks. Have y'all ever noticed like insurance and non-insurance? I'm like, really guys? It's like black and white too? Do we have different water fountains?
Nobody really seems to understand what goes on outside their own area. You know, billers, doctors, insurance companies, and it's easier to learn how to try and navigate through this convoluted system than it is to step back and say, well, why is it redundant? Why is it confusing?
I just can't understand why a hospital here and 30 miles down the road, a hospital here is just so much difference in the amount that they charge you. And I think it should range. I mean, yeah, granted, it's going to be a little bit higher, a little bit lower, but not in the thousands and thousands of dollars difference for the same type of treatment.
You are going to get an MRI. It should cost this much. Here, everywhere. It's the same procedure. The people who are doing it have had the same training.
That idea of transparency, just knowing exactly how much everything costs, and how much everybody's charging, like what everybody's rates are. Because I'm pretty sure if all those numbers were like out in the open, it would drastically change the way people did business. Because it's like, why would you go to a hospital that charged, you know, these outrageous fees when you could go and get the exact same care at another hospital and pay less. I love how they say insurance pays for things, but they go towards your deductible. To me, that's not covered by insurance. That's still paying out of pocket. I know it goes through, but I hate the way that that's worded. It's like buying a concert ticket that's $50 and you go pay for it and it's $80. It's like, that ticket's not $50, it's $80. The fees that are added to it, it's one of those things, like, just call it what it is. It's out-of-pocket expense. You can't say it's covered by insurance. That's bullshit. But anyway, that rant is over.
We use different language. We don't even refer to prices as prices. We refer to them as healthcare costs, as if it's abstract. You know, if somebody told you petroleum costs were going up, it doesn't make you mad like if somebody told you gas prices are going up. We can't even call a spade a spade. We have very little price competition, very little price transparency, and we have prices going up faster than inflation in ways that are eating away at increases in wealth in the United States decade after decade. And yet there's very little that people have been able to do to address this huge industry with its own culture.
When someone becomes a monopoly, costs start going up, sometimes you've got to break that monopoly up. And that's, you know, there's hospital systems that have, 30 plus hospitals under one umbrella in one town. That's a monopoly.
We are hearing stories of doctors with monthly quotas as to the number of operations they're expected to do. Emergency room doctors that are told to admit up to 50% of all patients over 65 just to meet their quotas. They're being harassed by emails and text messages if they fall below these quotas. Now those quotas may make sense in a car sales business. It doesn't make sense when you're talking about people's lives. It's not why we went into medicine, and it's what frustrates the people on the front lines of medicine all across America.
But we're the ones that are paying. See, that's the important thing. We're the ones that, if it isn't for us,
it should have a voice.
Yeah.
We're in pain and we gotta pay.
There's a myth out there that about 1 in 5 US dollars is spent on healthcare. It's actually much more than that. If you look at Medicare and Medicaid spending, yes, it's about 21% of the national expenditure. But did you know that about 10% of the defense budget is spent on health care? Did you know that Social Security payments are increasingly being spent for these copays and deductibles? Do you know that interest on the debt is in part interest on the health care debt? So the amount of money we spend as a nation on health care is probably closer to 30 to 31%.
I mean, if it wasn't for us saying that the system exists in the first place, they wouldn't have a system. We've agreed to it. We all make this sort of like decision that this thing is the way that it should be, or at least we keep paying into it to keep it going. And it's like, if people just kind of like really thought about it, maybe had more discussions like this, bigger discussions kind of in their own communities or whatever, and just said, you know what, this is broken. Like, why are we doing this?
It has to be systematic so that we're working as a community. Otherwise, it's too much for anybody.
You really can't be serious about addressing healthcare costs in America unless you're willing to be serious about the wide variations in quality, about addressing medical mistakes, the #3 cause of death in the United States, and getting at the 30% of healthcare expenditures that the Institute of Medicine says is going to waste and overtreatment. Should people that are over 80 years of age be getting a screening colonoscopy for cancer prevention? Should somebody who's 92 have a prostate biopsy? Should somebody who has a high cholesterol but is 100 years old be put on a cholesterol-lowering medication? Well, we're now learning if you're 100 years old and you have a high cholesterol, congratulations, you won. You don't need cholesterol, you don't need modern medicine to lower your cholesterol. Your body is probably a lot smarter than a lot of the medical books we use.
But you had mentioned something on the page about there being, I guess, you know, more disagreement between people, and it sounds like everybody here kind of agrees.
But people tend not to talk about it because they're afraid of the arguments. They're afraid of the politics involved. And this is just proof that people can sit in a room of all different ideologies, and I know you all are, of all different orientations, which I know you all are, and still have a civil conversation. This is what America's saying you can't do.
All healthcare professionals have to take the Declaration of Geneva upon entering service. It states, "I solemnly pledge to consecrate my life to the service of humanity. The health of my patient will be my first consideration." Politicians, lawyers, insurance companies, and lobbyists do not need to take this oath. We will all have to encounter the healthcare system as recipients of its care someday. Let us all hope the higher cost of surviving has not come at the expense of the humanity it has vowed to protect and care for.
That's all I got. Thank you.
So anyway, if like, you know, you could just kind of go like,
Yeah.
I can't do it, I'm gonna kill you. That's